Nice. Good. Good.
Oof.
Good.
Oh my God.
Hey guys, I'm Dr. Will here. I'm with one of my patients, and today we're going to show you guys what a typical adjustment looks like here at Miami Spine and Performance. So with this patient today, we're going to take her through a regular full body adjustment. She has some neck issues, some shoulder issues, and some lower back issues that we're treating. So I'm going to show you guys how I adjust it, and I'm also going to show you guys how I incorporate active release technique and cupping into my therapy. So I'm going to have you go ahead and lie face up for me to start, please. Slide this underneath here. So the first area that I'm going to adjust is going to be her thoracic spine. I know you guys love watching the adjusting videos, so I thought I'd give you a special treat today. Go ahead and scoot towards me, please. Maybe cross your arms like so. Just going to feel a little pressure, a little loud. Nice. Little adjustment there. Okay, now I'm going to have you lay on your right side, please. So a lot of times when you're sitting at a desk or sitting in your office for a long period of time, your upper back and lower back can get tight from the compression. So getting adjusted is going to help her decompress her spine, so she'll be able to sit longer without pain. Give you a little pull here. Okay, take a big breath in, breathe out. Got it. Other side. Not going easy on her today, as you can see. Okay. Let's go here. Take a big breath in. Breathe out. Good. Face up. So that was the thoracic spine and the lumbar spine. Now we're going to check her neck and see what's good and what's not. So go ahead and slide it towards me, please. That's good. Yeah. So a lot of times having stiffness in your cervical spine can cause headaches, it can cause jaw pain, it can cause neck discomfort.
Yeah, I get all that.
Check, check, check. And she's got some tightness in her upper traps as well. So like I said, we're gonna also do some muscular release up here to get her her neck a little more lengthened, a little bit less compressed. So we're gonna do a little adjustment here on C3 and another one on C5.
Oof.
Good. And then one a little bit lower on this side.
Oh my God.
Bingo. Okay guys, that is a typical full spine adjustment. Stay tuned for the next video. I'm going to show you how I'm going to release her upper traps and release some tension in her shoulders. Thanks for watching. Don't forget to like, comment, and subscribe.